Hello everyone, welcome back. Today I'll be covering a shock, a part 1 video. Started off with definition of shock, mechanism of shock, stages of shock, compensated, decompensated or irreversible shock, compensated shock by neurogenic means, hormonal means, chemical means. Mechanism occur in cardiovascular system, renal system, respiratory system, GI system, haematology system, and cellular level. Definition of shock: inadequate tissue perfusion, decreased oxygen supply, anaerobic metabolism, accumulation of metabolic waste. Mechanism of shock: widespread vasoconstriction and vasodilatation, altering the peripheral vascular tone and resistance. Reduction in the intravascular volume, inadequate cardiac output. Whatever the cause of shock, the body will respond in a similar way. The stages of shock: A. Compensated shock. B. Decompensated shock. The blood will move to more vital organs, that is the brain and the heart. C. Irreversible shock. Multiple system or organ damage. Even with treatment, death is the result. A. Compensated shock. The body is able to compensate and maintain the cardiovascular system dynamics by A. Neurogenic means. By responding to the decrease in blood pressure, the sympathetic nervous system releases the adrenaline or noradrenaline to raise the blood pressure and maintain the flow to vital organs. This figure shows the baroreceptor reflex control of the blood pressure. Number 1, the baroreceptors in the carotid sinus and aortic arch monitor the blood pressure. 2, the glossopharyngeal and vagus nerve conduct action potential to the cardioregulatory and vasomotor centers in the medulla oblongata. 3, increased parasympathetic stimulation of the heart decreases the heart rate. 4, increased sympathetic stimulation of the heart increases the heart rate and stroke volume. Number 5, increased sympathetic stimulation of blood vessels increase vasoconstriction. For compensated shock by hormonal compensation, B. Hormonal means. By responding to the drop in the renal blood flow causing angiotensin-1 and 2 to be released. Then aldosterone and ADH is released. This figure shows the renin-angiotensin-aldosterone system, RAAS. When there is a drop in the blood pressure, drop in the fluid volume, renin is released from the kidney. The liver will excrete the angiotensinogen. Renin acts on the angiotensinogen to form angiotensin-1. ACE, angiotensin-converting enzyme released from the lungs, will act on the angiotensin-1 to form angiotensin-2. The angiotensin-2 action will stimulate the adrenal gland to release aldosterone. Another action is it acts directly on the blood vessels, stimulating the vasoconstriction or narrowing. Aldosterone acts on the kidney to stimulate reabsorption of the sodium or salt, NaCl, and water to increase the blood pressure. Compensated shock, c.Chemical compensation. By chemical means, by responding to the ventilation or perfusion imbalance caused by the decrease in the pulmonary blood flow, chemoreceptors activate and increase in the respiratory rate and depth, decreasing the CO2 leads to alkalosis, which means causes cerebral hypoxia. This figure shows the chemical compensation. When there is a decrease in pulmonary blood flow and pressure, there will be decrease in saturation oxygen concentration. There will be increase in the carbon dioxide concentration. Activation of chemoreceptors, whereby the carotid bodies and the aortic arch will increase rate and the depth of respiration, and this will decrease the PCO2 and cause respiratory alkalosis. At the same time, it also stimulates the sympathetic nervous system. When there is a respiratory alkalosis, there will be a vasoconstriction and cerebral hypoxia will occur. For progressive condition, compensation mechanism fails to maintain adequate cardiac output. This leads to ischemia and hypoxia, anaerobic metabolism and production of lactic acid, pyruvate, and CO2, causing pH to fall, acidosis. Venous constriction, causing edema, erythrocyte, and platelet clumping. This inhibits the circulation and lead to C. Irreversible shock. This stage cannot be reversed. It occurs mainly due to decreased coronary blood supply, metabolic acidosis, presence of toxin from injured cells, and death follows. This figure shows the mechanism of compensation. When there is a decrease in blood volume, there will be stimulation of catecholamine to be released and reduction in venous return. Pain also stimulates the catecholamine to be released, and they will cause tachycardia. There will be an increase in cardiac contractibility, increase in myocardial oxygen demand, unfortunately, may lead to cardiac failure. Catecholamine release also causes peripheral vasoconstriction and reduced tissue perfusion. When there is a decrease in blood volume, there is a reduction in venous return, arterial hypotension, reduced tissue perfusion, and aerobic metabolism, acidosis, and myocardial failure. All this will lead to multi-organ failure, MOF. What happens in the cardiovascular system? When there is a reduced blood volume, arterial stretch receptors are stimulated. This will increase the sympathetic activity. Vasoconstriction occurs except for the brain and coronary. Markedly seen at the skin, visceral, splenic, and spleen. The heart will become tachycardia. Transcapillary refill will be delayed. For renal system, efferent more than afferent vasoconstriction. Mild reduction in GFR, but marked reduction in the renal blood flow, shunting of blood in the medulla, acute renal failure due to tubular damage, activation of the renal angiotensin-aldosterone system RAAS, reduce urine sodium retention and raise urea. For respiratory system, when there is an acidosis, chemoreceptors are stimulated and the respiratory center stimulation occur. Respiratory rate will increase about 2 to 3 times. The minute ventilation increase to 1.5 to 2 times. Circulating toxins and mediators of the cellular injury are exposed to the lung. There will be bronchospasm, acute pulmonary hypertension, VQ mismatch, pulmonary edema that will lead to ARDS. For GI system, gastrointestinal system, splenic hypoperfusion can damage the GI mucosa and predispose to translocation of bacteria and their toxic byproducts from the gut lumen into the portal circulation. This can produce bacteremia, gram-negative sepsis, MODS, multi-organ dysfunction syndrome. Splenic hypoperfusion can cause GI bleeding, ileus, acute pancreatitis, hepatic failure. In hematology system, platelet and clotting factors may be depleted by dilution, consume, DIBC or disseminated intravascular coagulation will occur. Platelet dysfunction without thrombocytopenia can be caused by hypothermia, sepsis, and uremia. In the cellular level, there will be anaerobic glycolysis, lactic acidosis, then there will be fail of sodium and potassium pump, increase in the intracellular sodium, increase in extracellular potassium will cause hyperkalemia, depressed myocardium, reduced peripheral response to vasoconstrictors. Yay, we have reached to the end of this video. Wait for the part 2 that I will cover regarding hypovolemic shock and septicemic shock. Till we meet again, take care and bye.